Hello, everyone. A very good evening to all of you. Today, we are going to discuss the case note of Malcolm Whittaker. So, this letter is written to Miss Harvey, the nurse unit manager at Broomfield Hospital. And the purpose, number one, is to inform her Mr. Whittaker's case. And purpose number two is to inform Mr. Whittaker's particular needs. So these two are the reasons why we are writing to Miss Harvey. So the letter has to be addressed to Miss Mariam Harvey, the nurse unit manager, orthopedic ward, Broomfield Hospital, Craven Road, Broomfield. Now let's go ahead and see what else the case of Mr. Whittaker. Today's date is 24 October 2020. We are a Parkinson's nurse specialist in a community health center. One of your patients is Mr. Malcolm Whittaker. So that's the basic information. Now, the patient was born in 1944. So it's quite an elderly patient. So we don't need the address and all here because the address, you don't need all these things. Now let's go ahead with the social background. Now you have no, if you want to include a retired solicitor, you can do that. Other than that, we don't have any relevant information in the social background. Now, family history also, we don't have any thing there. Now, regarding the medical history, many of our candidates asked that out regarding the medical history, that the excision of melanoma, prostate cancer, mobility problems, all these things. What we have here mainly is something related to Parkinson's disease. So you can write something about the Parkinson's disease, and that's ongoing treatment is going. That's since 2014. So why we are not writing about what happened in 1992 and 2010 is because 1992 it's around 20 years ago, and there is no persisting problem now. Now, regarding the prostate cancer, the treatment was successful, radiotherapy, the hormone therapy, everything was successful. And it's all, again, 10 years ago. So we don't need to mention that. What's ongoing problem is the neurological problem, that's the Parkinson's disease, and it was diagnosed in 2014. And we have the medications mentioned there, that's carbidopa, levodopa, the dosage to, and then the dosage increased to 8 tablets a day. That's something very special. Now, we have in the next segment is the annual checkups. So we have a lot of problems will be there in the annual checkups now, but we don't need to look all these things there. So we have because we are going for some specific procedure, that's splenectomy. So we don't have to inform what we have what he has experienced in between 2014 and 2018. So UTI, we don't need it because we are going to write to someone else. Now we have the main thing is the banning. Now, in 24 September 2020, he saw his GP because of the pain he had in his right foot and was affecting his mobility. So his GP referred him to the orthopedic consultant for specialist reference, and diagnosis was confirmed. So he has bunion. So the orthopedic doctor recommended him to do the surgical procedure, that's splenectomy, and that was scheduled on 18 December 2020. So this is all what we have, and that's relevant there. And now he came back to us after a month for the annual review that the Parkinson's nurse, that's the person we. So at the time of annual review, he mentioned about the surgery, and the discussion was made there. So we advise the patient to continue the medications when admitted for the surgery, and we have given written information to the patient regarding the importance of medicines and all these things. Now we are going to write to the nurse in charge of the patient's care in hospital ward. So that's Miss Harvey. Number one, to ensure medications given at set times. So we have to mention what medications in the letter. To check the availability of transdermal patches of patient's medications for preoperative use, because he will be nil per oral at that time. So that's all the letter is. So we need to inform about Mr. Whittakkar's relevant history and specific needs. The specific needs is is to continue medication and to check the availability of transdermal patches, and that's it. So let's go ahead with this thing. So Miss Marian Habby, Nurse Unit Manager. This letter has been written to introduce Mr. Malcolm Whittakkar, who has been under our care for Parkinson's review. So you can write like this, or you can introduce Mr. Malcolm Whittakkar, who has been reviewed regularly for Parkinson's disease. You can say like that. So that would be better. Who has been reviewed regularly for Parkinson's disease, because he's reviewed not only by you, he has been reviewed by a neurologist too. So we can make the changes right now. This letter is being written to introduce Mr. Malcolm Whittakkar, who has been reviewed regularly, who has been reviewed regularly for Parkinson's disease. Yeah, for Parkinson's disease. Okay, he is scheduled for a bunectomy at your facility on 18 December 2020. So let's read this purpose again. This letter has been written to introduce Mr. Mark Whittakkar, who has been reviewed regularly for Parkinson's disease. He is scheduled for bunectomy at okay. Now, Mr. Whittakkar has been on Parkinson's medication. That's carbidopa 25 mg, levodopa 1 tablet twice a day since 2014. So he had been, so there is a change here, had been. So in the past, so now right now we have a change. So it was has, now we made a change that Whittakkar had been Parkinson's medication. So we made it grammatically correct. The dosage was increased gradually, and now he takes 8 tablets a day. So, so 1 tablet thrice a day means 3 tablets he was taking daily. Now it was increased to 8 tablets a day. In addition, he has been receiving annual reviews from the neurologist as well as from our facilities. So that's all we have got here in the first paragraph. On 24 September, Ms. Whittakkar consulted his general practitioner with complaints of pain on his foot, which affected his mobility. Just make it a little bit clearer. Yeah. Complaints of pain on his foot, which affected his mobility, was then referred to an orthopedic consultant who not only confirmed pain on his right foot, but also scheduled the surgical procedure. So he was referred to an orthopedic consultant who confirmed his diagnosis and scheduled for this surgical procedure. Today, during his review to our facility, He revealed information regarding the surgery. Therefore, he was provided with both verbal and written instructions regarding the significance of continuing the medications when admitted for the procedure. So that's what we have said in the second paragraph. Now, towards the request, it would be appreciated if you could ensure all the ongoing medicines are given to Mr. Whittakkar at set times under your care. Since he would be nil per mouth, kindly check the availability of transdermal patches of his medications for preoperative use. That's all. If you have any further queries regarding Mr. Whittakkar's condition, please do not hesitate to contact me. You're sincerely Parkinson's care specialist. And I hope the letter is it became so simple. So the purpose, what we have written here is underlined the problems and specific requirements. That's it. We'll see with another letter soon. Till then, bye.